Today we're going to tackle Chapter 6 and Chapter 7. Chapter 6 deals with basic interpersonal skills, and then Chapter 7 deals with preparing for a client and ending a session. So we're getting into the nitty-gritty of what we're talking about. You guys need to think about your characters. I need those in. Um, uh, why don't you email them to me? I have to put them online. I have to put them on the discussion page. So what you need to do is email me those history forms after you decide. Now, don't forget to come up with a fictional name as well. Um, and like I've said over and over again, it needs to be a problem that you don't have or have never had, and or you may potentially suffer from relapse. And also, you probably ought to stay away from problems that you've been close to sometime in your life. So I don't know how much that leaves. There's lots of mental illnesses. I've got the DSM-5 and it's pretty thick. It's about 700 pages long, so there should be something in there. Okay, Chapter 6. Basic interpersonal skills. As we learned previously, a good counselor displays warmth, empathy, respect, genuineness. Additionally, a good professional must accurately observe, effectively attend, and actively listen. Not the easiest thing in the world, especially at 4 o'clock in the afternoon after you've been doing this for 8 hours. Observing means noticing all behaviors that accompany communication. This type of communication is known as nonverbal communication. It has to do with facial expressions, breathing patterns like sighing, gestures, movement, and posture. Now, as we are moving more and more into online counseling, this is going to become a little bit more difficult, potentially. But people are already able to, if you're able to read facial expressions, then you probably will be okay. You won't be able to see hand gestures or the way that their feet are pointed or whatever. But this is something that we need to think about as far as the future is concerned. Being a good observer increases understanding of what clients are communicating. Today, my wife and I went to eat lunch at the Country Cafe, and as we were sitting there, an old farmer came in, and he sat down at the counter. And I was telling my wife, just by looking at that guy, I can tell you a couple different things about him. She hates it when I do that, of course. But one of the things was that he had one leg shorter than the other, and that he was depressed. You could see it on his face. He certainly didn't have there wasn't any inkling of a smile or any pleasantness about him. It was really kind of interesting watching him moving around. He moved really slow. He hadn't shaved, which is, you think, well, yeah, but most people aren't shaving right now. But the answer, as far as he was concerned, it was scraggly. It wasn't well kept. He hadn't bathed. So there was a lot of things about this guy. I was kind of happy that we weren't close enough to have to smell what he smelled like. Um, yeah, he was in pretty bad shape. What are we talking about? We're talking about observing people, and of course this can become almost a problem. My wife told me the other day that it's really hard being married to a psychologist because you see everything and you notice everything. So she has to be real careful. She has to hide things from me, her feelings and whatnot. Otherwise, I can read them on her face. It can supplement what your client is telling you verbally, what you observe. It may verify what is being said or contradict what is being said. If a practitioner gets conflicting messages, the nonverbal meaning is usually closer to the actual meaning. Practitioners often comment on contradictions. Good observers pay special attention to facial expressions. Facial expressions can show any emotion. If the client shows no emotion, known as the flat effect, it may indicate depression. And of course, this is the individual who shot uh, President Reagan. And I can't think of his name right off the top of my head. Anyway, he was in a mental institution for an extended length of time. Of course, Reagan has died. I don't know. He died a decade ago or so, maybe more than that. Anyway, this guy has just gotten out of a mental hospital, and it was fairly obvious that he was suffering from depression. Other indicators of depression include little body movement and slumped posture. More sadness, on the other hand, is mere sadness is much more animated. If they're crying, they're probably not depressed. They're probably just sad. If they're making noise, they're probably not depressed. They're probably just sad. If they're looking down, uh, it's really kind of interesting. If they're looking at you, then they're probably not depressed, or they probably are depressed. If they're looking down or looking away from you, they don't want you to read their expression, then they're probably just sad. Increase in the amount of fluid in a person's eyes, of course, and that has to do with crying. Stress is expressed by muscle tension, movement, and shallow breathing. Looking away may indicate thinking, remembering, or being hesitant about talking. Clenched fists must be interpreted by the context of the situation and may indicate stress, frustration, anger, or anxiety. The counselor must remember that gestures are culturally developed, and so this is one of the reasons why you take cultural psychology, so that you can recognize the different cultures, potentially the different tribes in Arizona and New Mexico. They don't have the same cultural structures, and because of that, you need to understand their culture before you can read their expressions. I'm sure it's easy for you to read Navajo expressions since you're all Dene, but I'm not sure that you would be very accurate at reading Laguna or any of the Pueblos, maybe the Apache. I had a friend who was a Comanche. Um, on the Navajo Nation, he was a Comanche, and it was really kind of interesting because I lived in Oklahoma for 4 years. I had lots of friends who were Comanches, so it was easy for me to read that guy. But he said he, he said, "Wow, the Navajos are really bad at reading people's expressions." Well, what he meant was they were really bad at reading his expressions. But of course, since I had lived in Oklahoma, the two of us were fairly good friends because we knew each other. We could read each other. Nice guy. When someone experiences strong emotions, their skin tone may change color, darkening or looking rosier than usual. Skin tone change usually starts at the chest and moves up into the face, and that's something that you notice. So if you can see any part of their chest, if you can see it suddenly reddening, you'll see it move up into their neck, and then maybe it'll get into their face. Possibly it won't, but you know that they were either embarrassed or something is changing. Maybe they're getting angry. What emotion do they seem to be displaying? Do they have tears in their eyes? Is the mouth turned up or down? Is the brow wrinkled? Are there circles under the eyes? Are they smiling? And of course, the more you interact with this individual, the more you recognize their facial expressions, because everybody has individual facial expressions. Some people try to fake it, and that's really tough. Usually you can read it. Um, and of course, the longer that you have been talking to them, the easier it is for you to read it. Eye movement and eye contact. Are they looking mostly at the floor? Are they looking mostly at the ceiling? Are they looking around the room? Are they looking directly at another person? Are they staring? And this is all important. Body position, how are they sitting? Are they leaning back, slumped over, slouched, upright and stiff, legs crossed, feet flat on the floor, legs curled under, legs crossed, ankles crossed? All of these things are pretty important. And of course, when you see it, you'll recognize what facial expression goes with what body position they're in. Body movement, did they hardly move at all? Did they move slightly? Did they fidget most of the time? Did they nod their head or swing their legs? Did their movement change during the interchange? Breathing pattern, did their breathing seem normal? Did they often sigh? Did they take deep breaths? Did they breathe in a shallow way? These are all important aspects. Muscle tone, are their fists clenched? Is their jaw tightly closed? Are they slumping? Is their face slack? Has their muscle tone changed during the interchange? Of course, that can mean a change of emotion. Gestures, what were they doing with their hands? Did their hands stay in their lap folded together? Were their hands moving around most of the time? Were their hands in tight fists? Did they make circles with their arms or hands? Did they show their palms? Skin tone, did you notice any change in skin tone? And people say, well, only white people change their face changes. I've had friends who were very dark, who were African American and were extremely dark, and you can tell, you can see. And the question is, what are you looking at? Are you really looking at their skin? The insides of people's mouths are everybody has pink. The inside of their mouths. You can look at their gums. You can look at their fingernails. You can see change. You can see change. You can certainly see. You can tell when somebody isn't feeling good because they look paler. If you've been around this person, then you know what they look like when they feel okay, and you should be able to read when they are not feeling very well at all. When in a group therapy situation, it is important that the practitioner observe everyone in the group. They should not only observe the individual speaking, but how the members of the group are reacting to what the speaker is saying. When the practitioner scans the group, it also encourages the speaker to speak to everyone, not just the practitioner. Often in a group situation, there will be two leaders, and the two can trade off assignments of observation. It is necessary to observe the people in large groups, so this can be done by looking for telltale actions of individuals or groups of individuals: fidgeting, facial expression incongruence, shoulders hunched, mouth pinched, eyes closed. Attending involves being totally focused on the client. Attending isn't as easy as it seems. Often when we are listening to someone, we are hearing what they are saying, but we are trying to compose what we are going to say when it is our turn to speak. And of course, this is not a good idea. What you need to do is you need to be totally focused on them, not thinking about what advice you would give them, or thinking about anything except what they're saying and interpreting what they're saying. Well, there are some cultural differences in the way that someone shows attending. For the most part, it is shown by leaning slightly forward in a relaxed, comfortable position, sitting in an open, accessible way. Face expresses appropriate concern. Facial expressions are extremely important. The facial expression should be congruent to what the client is relating and experiencing. For most people, this comes naturally, but some are taught to smile or laugh at adversity. Maintaining regular eye contact is another way that you can show that you are paying attention. People from Asia and those from Northern Europe tend to prefer a more peripheral gaze, finding the direct stare too intense. Any distracting behavior, including taking notes, should be avoided as it distracts from the process. They may see fidgety movements on your part as disinterest, impatience, or boredom. Another way to communicate involvement is through minimal encouragement. Minimal encouragement involves repeating one or two words a person says by nodding, saying something in the affirmative like "uh-huh." Normally, what I do is nod, and I will say "uh-huh" from time to time. Listening involves fully focusing on what the other person is trying to communicate. Listening actually goes beyond attending. Most of us are composing in our own minds as others talk to us, but listening is total absorption in what the client is saying. And of course, that's what you need to do. Listening isn't just hearing the words, but conveying the understanding of the implications of what the client is saying. While listening, the practitioner uses minimal encouragement to get the client to continue disclosing. And that's what you want. You want the client to continually disclose the information that you're seeking. You need them to purge themselves as much as possible to get out the feelings that they need to get out. Listening involves noticing the client's communication style, including tone, volume, speed of delivery, noticing pauses, silence, changes in patterns of speech. Communication styles vary by culture and between families. Direct, clear, easy to understand. Some use jargon or colloquialisms. Some use a narrative style. Some have a confused circular manner. They jump from one topic to another. They do not complete their thoughts. And this is common in some family groups. It all depends on how often the child was allowed to speak. Sometimes they were constantly being interrupted or being given advice by their parents, by their elders. Of course, this would make their speech pattern more abrupt because they're used to being interrupted. Sorry, I had to move something. Communication can only take place if you allow the client proper time to express their thoughts and feelings. Silence is good for the client as it allows them to garner their thoughts. Many practitioners are uncomfortable with silence and they want to fill it with their own voice. And this is a mistake because you need to let them think. And depending on what what culture they come from, they may need silence. Silence is very important. I had a friend who was, for some reason, he decided to study American Indian studies. He was a Jewish fellow from New York City, and so he went to New York University and NYU. He went to NYU, and so he studied American Indian studies, and he decided to do his dissertation on the Navajo people. So he came out to Arizona and New Mexico, and he found a collaborator, and they went to an elder's house, and they were talking to them, and John said, so he's talking to this guy, and he paused in between all of his statements, and so John said, "Why do you pause for such a long time?" And the elder sat there and he thought for a couple of minutes, and this took like twice as long for him to answer. And he's sitting there looking at him, and he said, "You know, John, your questions are so interesting that I have to really think to find the best answer for you." And after that, John, of course, didn't interrupt the people he was trying to interview. It's really kind of interesting. Even when practitioners are fully focused on listening, so this can really be a serious problem. This being uncomfortable with silence. This can especially be an interesting problem for white people. White people don't like uncomfortable silences. They refer to them as pregnant silences. But the reality is, other cultures, they use silence as a way of calming and cooling down the situation. But there's a lot of white people out there that just can't handle silence. Even when practitioners are fully focused on listening, they may misinterpret the client's words. A client may use emotional words differently because of cultural or familial imperatives. Interpretation must be explained by the client. A good example of this is when you're talking about sex or anything that has to do with sex. It's really kind of interesting to listen how people try to talk around the topic because it's so controversial. And in some cultures, it's completely taboo, and they're not supposed to talk about women's reproduction or men's penises or sexual intercourse. All of those are taboo subjects and can't be talked about. I grew up in a different kind of family. My mother was a nurse. No, there were no topics that were off limits as far as we were concerned. So that makes me a little bolder than other people when I'm talking about sex or about human body parts. It doesn't really, to me, it's just part of life. I worked in medicine for an extended length of time. Nudity doesn't affect me at all because that's just what needs to happen. Sometimes you need, sometimes you would walk into an emergency room situation, and the person would be lying there completely naked on the gurney, and if you reacted to that, then potentially you couldn't do your job. So that's part of what's going on. Um, it's just a little bit different, I guess. What the client says affects the practitioner. It is important for practitioners to listen to their own responses as a way of further understanding what the client is saying. If a client is speaking in a monotone about something very sad and the practitioner does not experience any personal response to this, it is important to determine whether the client is allowing himself or herself to feel the feeling or the practitioner is detached. Warmth is expressed through demeanor, concern, acceptance, tone of voice, posture, listening carefully. Touch can be a way of expressing warmth when used appropriately. I think I've told you guys this before. The tribes up north, the Blackfeet, the Assiniboine, the Gros Ventre, some of the Siouan tribes, the Crow, they're big huggers. They hug each other all the time. So when you're up in when you're up in the northern plains, uh, hugging people is just what happens. I can remember when I left Montana to come to Iowa. Everybody came over to my house to give me a hug. It was really kind of bizarre. The Navajo, not so much. You guys, touching is not something that normally happens. It's not spontaneous. In the northern plains up in Montana, it's just something that happens constantly. People are hugging each other. Uh, Kind of interesting, and it's something that you need to be careful of because some cultures, of course, don't touch. Other cultures stay way far apart. I can remember I was working with I think I told you this story. I was working with a lady from Canada, and of course they are English, and Canadians tend to have English. Uh, they have their taboos, and I'm from Indiana, and I'm of English descent myself, primarily. So the areas that we try to maintain for ourselves, our personal spaces, are quite large, and sometimes we'd be yelling at each other from across the room because that's how close we felt comfortable with. Um, it's it was really kind of interesting, and people would laugh at us because, we would be completely across the room to have a conversation. But my personal space was quite large, and so was hers. I had been on the up in Montana where everybody's a hugger, so you have to get close to people, and that was a little bit different for me. But everybody has their own culture, and everybody grows up in a certain cultural mindset. The appropriate expression of warmth can depend on many diversity issues. Gender influences how warmth is expressed. Particularly, this is influenced by various religious or spiritual beliefs. Racial and ethnic differences and cultural norms influence the expression of warmth. The power differential between different people can confuse how expressions of warmth are interpreted between a child and an adult, a doctor and a patient, or a person with perceived economic power with one who does not have this. Really kind of interesting, when I was at Ashford, a lot of my students were Hispanic, and some of them were, well, most of them were from Chicago, and there was one girl that found it. She read the way that I had just come down from Montana, so had just been around all those American Indians and all the Northern Plains tribes, and she recognized the fact that I would get a little bit closer to people than they were used to, and but she was Hispanic, and Hispanics are very touching people. They like to touch each other, and so she gave me she was able to interpret the fact that I needed somebody to hug me, and so she she recognized that, and the it was interesting because other Hispanic students would say, I noticed that too, but I didn't think that we could do that, that somebody could give somebody else a hug. Uh, that was, we're in the middle of Iowa in corn country, but she recognized that. She was a psychology student, and she has a degree in psychology. She finished her degree at Iowa State University, and she's a psychologist now. She's working as a psychologist with underprivileged children up in Chicago, and she just gave birth to her second child. Expressions must be genuine due to the way the brain functions and thousands of years of history. Individuals are quickly able to pick up warmth that is not genuine. It is important for the practitioner to observe the client's response as a way of judging how warmth was experienced. Warmth evaluation scale, level 1, the practitioner communicated little or no concern for the client and appeared cold, detached, stiff, and or mechanical, as this guy is. Mechanical. There we go. Level 3, at least half the time, the practitioner verbally and non-verbally communicated concern and caring appropriate to the unique needs of the client. Level 5, the practitioner's facial expression and posture consistently communicated concern and caring appropriate to the unique needs of the client. And this is a movie. This is kind of interesting. It's called The Meetings of Anna, or The Rendezvous of Anna. Anna is a filmmaker, and she's trying to get people to show her film in their cinemas. Anna has lost her husband. He divorced her and ran away with somebody else. And she's had various lovers around Europe. She's Belgian. And the Belgians speak French. They speak the Dutch, and they speak German. They tend to speak three different languages. Dutch and German are very similar. So it's really kind of interesting as she's going to Paris, and she's going to Berlin, and she goes to Amsterdam, and she goes to Brussels. She does a lot of thinking, and we get to see her making facial expressions a lot. It's really a fascinating movie. I would suggest it to anyone. I think there's a little bit of nudity in it, however. This is her sitting in a train and thinking about, she has a girlfriend, and it's somebody that she talks to that she's never had sex with. and she has various male lovers around. She had had an affair with somebody in Berlin, and she has to go and talk to them. So it's really interesting to watch her facial expression. This is this is her facial expression. As you can see, if you were to look at this person in a railroad car in Europe, you'd probably think that they're probably depressed because she has that flat look on her face. And she is in another railway train, railway car. And once again, she has a pretty flat expression on her face. She hasn't decided what's going to happen with her life. People aren't really accepting her movie. It looks like this is a wasted trip. She keeps meeting with old lovers. She keeps thinking about her girlfriend or the person that she thinks of as her girlfriend. There we go. Same thing. She's just talked to one of her former lovers, and she has kind of an empty look on her face. And there she is after having sex with her ex-husband, actually. She's got a little bit of a smile on her face. And eventually she goes home and she plays the answering machine, and all these people are asking her, get back in touch with me. I would like to make contact with you. The last message is from her girlfriend or her potential girlfriend. She sees her mother. One of the people that she sees is her mother, and her mother. Her mother wasn't very warm as when she was a child, and so they have a kind of an argument. The mother's getting married. She's got a boyfriend, and she's getting married, and she wants Anna to come to the wedding. And it's after that that she hooks up with her old ex-husband. Just a fascinating movie. I would suggest it to anyone. The Meetings of Anna, and that's the end of that chapter. Let's go on to chapter 7. Preparing for the client. Chapter 7. The practitioner must get ready to meet with clients. They must gather referral information. They must gather forms. They must gather whatever needed supplies they have. They need to find out as much as they can about a client. Now, normally, the only information you're going to have is the history. So one of the things you're going to need to do when you start counseling is reading the history of your client. And that's one of the reasons why I need you to come up to write out that history of whoever your character is. Purpose or agenda for the meeting is clarified, and that, of course, is what the practitioner is there for. The practitioner must consider the client's needs in the physical arrangement of the building, the waiting room, and the meeting room. If the client has any physical limitations, then the practitioner must make appropriate alterations. It's really going to be interesting this weekend. This weekend is my 50th college reunion. I will drive down there on Friday, and it's primarily Friday and Saturday, all day Friday, or Friday afternoon, and then Saturday all day, and then Sunday we'll have a breakfast, and then that will be it. But I'm going to see some of these people I haven't seen for 50 years. Some of these people I don't know. Some of these people I have come in contact with 5 years ago because that's the last time we had a reunion, but I haven't seen them in 5 years. I will be 72 in October, and I was the youngest person in our class. So it should be interesting to see all of these people that are a little bit older than I am. I looked like I was 12 until I was in my 30s. So it should be interesting to see these people who have aged more normally than I have. I was a young looking person. So it should be interesting to see how this works. So one of the questions is does anybody have any physical limitations? Back when I was young, people didn't make it into their 70s. This would have been a rarity. But now, of course, we have people that are living a lot longer. We have people that take care of themselves better. So it should be really interesting. I've lost probably half of my friends from my graduating class have died because they just didn't make it. they they died of this, that, or the other. Usually cancer or a heart attack. So it'll be interesting, and I'll talk to you guys after next week when we tackle chapter 8. I think we're going to tackle chapter 8 and 9 next week. So I'll talk to you about my reunion, and we'll talk about how things went. The client's culture should be considered to be to ensure that all appropriate steps are taken to make the session as beneficial as possible. If the practitioner does not have a working knowledge of the client's culture, then it is appropriate to research the culture with the understanding that such writing is often stereotyped and inaccurate. And the other thing that you need to think about is, sure, you're on the Navajo reservation, and most of your clients are going to be Navajo, but are they traditional? Are they Christian? Are they Mormon? Do they go to the Native American church? Do they? One of the things that happened up north on the reservation, an evangelical group came in, and they started referring to people's Indian names, their last names, their family names, as heathen. And one of the things that happened was that people that were part of this church, Native Americans who were part of this church, started changing the way that they wrote their last names. They would write them in lowercase instead of uppercase, which was kind of interesting because I had a colleague who was one of these evangelicals, and she would write her last name with a lowercase, and her husband worked there. He was also a colleague, and he would capitalize his name. So it got real confusing as to who you were dealing with. So these are all important things. These are, just because somebody's white doesn't mean they act in a certain way. We should never stereotype. Just because somebody's an American Indian doesn't mean that they act in a certain way, or that somebody's African American, or that somebody is Asian or Hispanic or whatever. We need to be careful, but we need to understand their culture so that we can read their culture in the way that they act. It may be that they don't act that way, but it may be that that's very important to them. The practitioner needs to understand how the client may feel about the first meeting: embarrassed, hesitant, uncomfortable. The practitioner must put away all distracting thoughts so that they can concentrate on the needs of the client. Beginning the first meeting appropriately is essential to the client-practitioner relationship. First impressions have lasting effects on future interactions. The greeting is essential to connecting with them. Ground rules need to be clarified, the purpose of the meeting, the length of the meeting, any special considerations that need to be addressed. When greeting the client, be aware of loudness of your voice, eye contact, and how you address them. Issues of privacy and confidentiality are important in how you first meet your client. If you must identify a person in a waiting room and cannot guess who your client might be, you can say very quietly, "I am Jesse Melendez. Are you Ms. Chin?" If a receptionist is able to identify your client, you can just identify yourself to the client. Be aware that many clients experience some shame in seeking help, so confidentiality is very important. So you probably shouldn't mention their name until you get into your office. Now, one of the other things to remember is that if your client is female, then it's maybe impossible to identify their racial group or tribal group or whatever from the way that they look. If somebody is married, if a Caucasian lady is married to an Asian, then she may be Ms. Chin and not the Asian lady that's sitting beside her. If it's somebody who's a blonde haired and blue-eyed Scandinavian, and their name is Melendez, then it's possible that they are married to a Hispanic gentleman named Melendez. So you have to be careful. You don't want to start off on the wrong foot by misidentifying somebody. The practitioner should invite the client to introduce themselves. The practitioner should determine how the client wants to be addressed. Some people don't like to use their first names. Using a last name in any circumstance shows respect for the client. You need to ask them before you can use their first name. You can't just start calling them by their first name. They may have, I'm kind of a good example. Where I come from, if you call somebody by their last name, it's an insult, and it means you want to have a fight with them. That's the way to get into a fist fight, is by referring to somebody by their last name. It's insulting, but that's where I come from. The other thing is that I have a title. You can call me professor, you can call me doctor, but I don't really want people to call me by my title. I don't want to be referred to as doctor. I'll get myself mixed up with a surgeon or something. So I would rather they call me by my first name. People tend to feel more comfortable with professionals who fully explain the process, what they're going to do, what will be expected of each person participating, the purpose of the meeting, limits of confidentiality. When beginning meetings with children and adolescents, explanations will need to be made that they can understand. Special issues of confidentiality will need to be covered. Education about your role is important, as well as what you expect of them. How you will include their parents or caretakers also needs to be made quite clear. You need to be sure that they understand that if they tell you that they're having wild sex with the football team, that is information that you have to disclose to their parent. If they're doing something that is inappropriate, or if they're doing something that's dangerous to them, then that information has to be disclosed to their caretaker or parent. First meetings with groups and families, be sure that members of the group are acquainted with each other. Clarify ground rules for talking. Explain what the role of participants will be. In families, you may want to ask how the members want the family to be different. Confidentiality needs to be discussed, and an agreement reached about how information will be shared outside the group or family. For subsequent sessions, some practitioners like to start their sessions by allowing the client to initiate the conversation, thus setting the direction of the meeting. They may say, "Where would you like to start? Let's begin by discussing the progress you have made since our last meeting." A good way to start, a good way that I've always found to start, is by saying, "Is there anything that you need to talk about?" A lot of times they will be planning, they will have these plans about what they're going to talk about today. They're real excited about coming in because this is what they want to talk about. And that's what I want them to start with. I want them to start with what they want to talk about. If they start where I want to start, then possibly, for one thing, they're not going to be very enthused about talking to me. And the other thing is that they may have something that they need to say. They may have something that they need to talk about. And that's what I want. I want them to talk about what they want to talk about. Confidentiality is one of the most important elements to address at the beginning of the first meeting. You need to assure clients that information shared with you will be kept confidential, that it will be kept secure, that it won't be shared with others unless they sign a consent form. Now, some offices, depending on what that office is, they have people sign a consent form that says that they can share the information with other individuals in their office, with other individuals in that group. That allows them, if they're not there when the client comes in for an emergency or whatever, for them to disclose to somebody who might have to take over the case, that will fill them in about what's going on. One of the hardest areas for clients to understand is mandated reporting of possible harm to self or others, suspected child abuse and neglect, or elder abuse. So if something illegal is taking place, suicide actually is, there are laws against suicide. So if you commit suicide, you've broken the law. Not that anybody's going to punish you, of course. So if you are indicate that you are possibly going to hurt yourself, or you want to murder somebody, then that information has to be disclosed to the authorities. Begin your discussion of confidentiality by covering the legal limits of your state, and of course every state is different. Explain the boundaries of confidentiality. Most agencies will have a statement of confidentiality and informed consent that clients must sign during their first appointment. If a client is mandated by the court to see the practitioner is required to report back to the court. Client counselor privileges do not exist as far as court-mandated counseling is concerned. If the client is considered a minor, the parent or guardians usually have the legal right to know what happens in a session. Each state has their own laws regarding sharing information with parents. Many practitioners will only disclose information if the child's behavior is a threat to self or others. Possible problems a minor could disclose: being sexually promiscuous, using drugs excessively, threatening to run away, having been abused or neglected, feeling suicidal, feeling homicidal. Groups create additional issues in confidentiality. Confidentiality must be discussed during the first meeting. Most practitioners recommend that the group members agree not to discuss information covered in the meeting outside the group or with anyone in the group after the meeting has ended. Many organizations require administrative contracts, which may include detailed descriptions of the nature and the limits of confidentiality, explanation of when disclosure is explanation of when disclosures are required by law, what to do in case of emergencies, payment terms, confidentiality of records and email communications, rights of the client to review records, telephone and emergency procedures, cancellation policy, information about the practitioner's qualifications, training, education, and licensure. Other information that the client needs: payment, emergencies, telephone or email contact, how contact between sessions will be handled, cancellation policies, and length of meetings. The closing of a session is just as important as the opening minutes. The practitioner may want to discuss possibility of future meetings, what has been covered in the sessions, request feedback. Ask a client what has been helpful, support the client's courage. Keep in mind that different cultures have different expectations. Closing statements that you might use: how would you like to end today? We have 10 minutes left today. This seems like a good place to stop today. We've talked about some important things today. Although we need to end for now, it seems like it might be helpful to continue our discussion next time. We have 15 minutes left. Do you have any closing thoughts about our meeting today? Let's talk about what we have accomplished today. What did you find most helpful in our work today? I would recommend that we meet weekly for the next 4 weeks and then evaluate our progress. Does that plan sound okay to you? We are about out of time and have covered most of the points on our agenda. I think this is a good point to end. Shall we meet again next week at the same time? And that is the end of chapter 7. So I'll talk to you guys again next week.